During this video presentation, I'll be going through exercise prescription for specific groups. So firstly then, I'm just going to go over a bit of general exercise prescription. So when an exercise program is being made for anyone, no matter what specific group they're part of, it should always follow the FIT principle. So as you can see on the screen, the FIT principle involves the frequency of the exercise which is in other words how often it's carried out. The intensity is how hard they train, so it could be a certain percentage of max heart rate. Time is how long the exercise is done, and finally type is very simply the type of exercise you'll be prescribing, whether it's weight training, running or swimming, etc, etc. So for each specific group, each principle will vary dependent on the group. So for example, elderly people wouldn't usually be training as often as younger people, so they'd have a lower frequency of exercise, and similarly the exercise would be prescribed at a lower intensity compared to a younger person. So the use of the FIT principle is mainly put in place just to ensure that exercise it's helped as almost like a motivation, and it also ensures that people stick with it. Just a way of helping them map out how long they actually will be training and making sure they stick to their training routines properly. Secondly then, it's contraindications to exercise. So there's two types, which is absolute and relative. So an absolute contraindication means that someone must not take part in exercise if they have this condition. So for example, things like a recent heart attack, and acute heart failure. So obviously someone who's recently had a heart attack shouldn't be taking part at all in any kind of cardiovascular exercise, any kind of exercise that's going to put a lot of strain on the heart. Obviously, due to recently having a heart attack, they need time to recover. And similarly, someone with acute heart failure, which includes symptoms like anxiety, tachycardia, shouldn't be taking part in high intensity exercise at all, as it can cause severe damage. On the other hand though, there's relative contraindications. So someone with relative contraindications can take part in exercise, but their condition might need to be seriously monitored when they're taking part in exercise. So someone with a high blood pressure, for example, which is obviously a serious condition that can lead to coronary disease, heart failure and stroke. Someone with high blood pressure can still take part in exercise, but it's something that needs to be closely monitored, because if it goes too high it can lead to things like a heart attack or heart failure, stroke, etc, etc. So they can still take part in exercise, but the FIT principle might be changed for them, so the intensity or the frequency might be lowered to ensure that none of the something like a stroke or heart failure doesn't happen. So secondly, another relative contraindication is muscle injury. So it could be any damage to a particular muscle in the body. So it could be a pulled hamstring that obviously prevents what someone can do. So someone with a pulled hamstring, a football player, obviously wouldn't be able to play football anymore. Well, not anymore, but during when they still hold the injury. But they could still go to the gym and do upper body work, as long as it's not causing any strain or damage to their damaged hamstring. And finally then we've got pregnancy as a relative contraindication. So pregnancy only kind of becomes a contraindication in the second and third trimester, so in the later stage of pregnancy. You often see pregnant women in like the first trimester still following their exercise routines from before, because it doesn't actually cause much damage to them. But in the later stage of pregnancy, this is when they really need to be careful of the type of exercise that they're getting involved in, to ensure they're not doing any damage to themselves and also the baby. So the first group that I'm going to kind of look into and look at exercise prescription for is elderly people. So some contraindications that elderly people may have are having mobility problems. That's probably safe to say that a lot of elderly people have mobility problems just as you get older, and also arthritis and osteoporosis. So osteoporosis is obviously like the weakening of the bones. In terms of prescription, so it is usually recommended that seniors aged 60 and above exercise for at least 2.5 hours a week. So obviously that's not very high frequency due to their bodies becoming older and a lot more fragile, but it's still important that they do still exercise, like I just said, for at least 2.5 hours a week. A perfect bit of exercise for them to do is swimming. It's extremely joint friendly, so it doesn't put a lot of stress, pressure on the joints at all. So it limits the damage to joints and also the bones. Obviously, someone with osteoporosis having weaker bones, taking part in some exercise could lead to a higher risk of a snapping of the bone. But swimming is obviously being in water, floating, puts no stress on the joints at all. So that's why it's called a joint-friendly exercise. But it also helps massively with upper and lower body strengthening. So even if swimming's done at a low intensity, it's still going to help massively with ensuring that the upper and lower bodies of the elderly people remain strong, and they maintain some muscle mass, which is obviously crucial for day-to-day life. Kind of like I just said, it should be done at a low intensity to avoid putting stress on the heart as well. Obviously, as you get older, your heart becomes a lot weaker, so you shouldn't be pushing it too high in terms of max heart rate. So it should be done at around 60 to 65% max heart rate, and it shouldn't really be done any longer than 20 to 30 minutes. So group 2, the second specific group is pregnancy or pregnant women. So contraindications for pregnant women are a change in posture, lower back problems, and damage to the baby, or obviously at worst case scenario, miscarriage. So exercises that pregnant women should look to avoid are exercises that involve contact, obviously to avoid any damage to the baby, and also any exercise that involves kind of rapid change of movement or jumping up and down should also be avoided. So flexibility training is ideal because it can be done throughout all of pregnancy, as long as it's not causing kind of any inappropriate strain or pain anywhere in the female's body. Some exercises within flexibility training could become a bit more limited in the later stages of pregnancy, obviously due to the size of the female's belly changing, so some movements and motion might become a bit more limited, but it can still be done. It can still be done but supervision would probably be extremely important to ensure that all stretches are being done properly, to avoid any damage to the body. In terms of frequency, it ideally could be done around 3 to 4 times a week, but obviously in the later stages of pregnancy this might change to about 1 to 2 times, just simply to do with the not wanting to be involved in exercise as much, as it can become a bit hard obviously in the later stages. But obviously it's a perfect thing, so things like Pilates and yoga are very common and perfect thing for them to do, because it keeps them active-ish. Obviously it's not done at a very high intensity, it's quite a low, it should be and usually is a low intensity thing, but it's great for helping keeping flexible, also avoiding any kind of back issues or upper body issues, so it's perfect for that. So I've already said that flexibility training can be done throughout the whole of pregnancy, but obviously, like I've said, during contraindications of pregnancy being a thing, in the earlier stages of pregnancy, normal exercise can still be carried out. the female will probably be told by this by a doctor, but in the early stage of pregnancy, they can carry on doing their normal exercise routine, because it won't cause any issues for them. But obviously, as it later on in pregnancy, they will be told that they should stop doing certain exercises like cutting contact or any exercise that puts a lot of strain on areas like the lower back or the abdominal muscles, and that's when things like flexibility training, like yoga and Pilates, will be prescribed to pregnant women a lot more. So finally then, young people. So some contraindications for young people. So less developed bodies can lead to a higher chance of muscular injury. So obviously having a muscle injury is going to affect the amount of sport you can take part in, or certain sports you can take part in. Asthma is another contraindication. So lower tolerance to anaerobic exercise, and also diabetes is a final contraindication. So unless of any physical problems, young people are able to take part in a huge variety of exercise without needing to worry too much about the effect on the body. So for example, you often hear of kids taking part in 4 different sports clubs a week, and they can take part in multiple clubs like football, rugby, tennis, netball, gymnastics, etc., without kind of worrying about the effect that it has on their body compared to elderly people, for example. But if we look into cardiovascular exercise as a prescription for younger people, so cardiovascular exercise is obviously really important from a young age, because it contributes massively to the strengthening of the heart as a pump, and also the efficiency of the lungs. So the intensity can vary. For younger people, they could be working at 50% max heart rate, or they could be working all the way up to 95% max heart rate. The duration of the cardiovascular exercise can also vary dependent on what they're doing. So they could be doing a football training session, which obviously will involve a lot of running about, which is cardiovascular exercise. This training session could be an hour and a half or 2 hours long, or they could just be doing a 30-minute run as part of athletics, or as in their own time to help maintain fitness. And also frequency. Younger kids can easily be doing exercise 5 to 6 times a week if they want to, without needing to worry about the effects on the body, obviously, which is not the case for an elderly person. But one thing that I will mention about prescription for exercise for younger people is they're prescribed the exercise to do, but I think it needs to be hammered home more, the cooling down afterwards, because you often see kids, yes, they're able to go on for hours and hours running about, but afterwards they very rarely cool down. Obviously, it doesn't have, for them in the early stages of life, it doesn't have a big impact on their body, but when they become older, they could really start to feel the effects of not cooling down properly. So they might suffer from arthritis more, or just a complete lack of mobility due to not cooling down more. So I think things like flexibility training need to be prescribed a lot more for younger kids, to ensure their bodies are in the best possible shape to be able to compete and take part in exercise the amount that younger kids can.